Good afternoon, and welcome to the FSMB Foundation Luncheon. I'm Dr. Jan Ryan, President of the FSMB Foundation. It is my pleasure to welcome you to this important event, and I want to thank you for supporting the Foundation through your participation today. As the philanthropic arm of the FSMB, the Foundation undertakes research and education projects to benefit state medical boards and their communities. The FSMB Board of Directors reflects the diversity of the FSMB Foundation and its member organizations, and we greatly appreciate their many contributions. Currently serving on the FSMB Foundation's Board of Directors are Vice President Randall Manning, Treasurer Ralph Loomis, Secretary Dr. Hank Chowdhury, Directors Dr. Claudette Dalton and Kathleen Haley, who could not be with us today, Dr. Art Hingerer, Dr. Pat King, stand please, Dr. Ken Simons, and Dr. Sarv Turkanda. Before we welcome our keynote speaker, I would like to start off by giving a few updates on the Foundation projects and initiatives. Through the generous support of the FSMB, its member boards, and individuals such as you in this audience, the Foundation has been able to fund projects and initiatives. And I'm very pleased to tell you that we were able to fund 4 COVID-related grants this year. Those grants went to the Association of Medical Schools of New York for an initiative entitled New York Pathway to Early Graduation and Licensure for Physicians during the COVID-19 pandemic, Lessons Learned and Way Forward. Another grant went to Honor Health of Scottsdale, Arizona, which has undertaken a project aimed at improving health equity via telemedicine. The third grant went to the Ohio Physicians Health Program, which took an in-depth look at the impact of the COVID-19 pandemic on the health and well-being of Ohio's healthcare workers. And the fourth grant was awarded to the Center for Connected Health Policy Public Health Institute of Sacramento, California, for a project entitled The Impact of Audio-Only Telephone in Delivering Health Services During COVID-19 and Prospects for Future Payment Policies and Medical Board Regulation. As you can see, your support of the Foundation is truly making a difference with issues in the healthcare community that we're dealing with today. I'm also pleased to report that grant funding will be made available in 2022 that aims at advancing medical regulatory complaint data research. The goal of these grants is to help individual state boards improve their understanding and use of complaint data to advance patient protection, to advance dialogue within the medical regulatory community about the use of complaint data, and to encourage consistency and best practices among state boards in complaint data collection and use. Finally, I wanted you to know that the FSMB Foundation is laying a foundation for its future by updating its strategic plan. The Foundation's last plan, developed in 2017, was aimed at widening its impact and long-term sustainability. Well, over the past 5 years, the Foundation has significantly raised the level of its core funds available from the numbers and types of grants that it distributed. And along the way, it's provided nearly $250,000 in funding to support projects aimed at the opioid epidemic, license portability, emergency preparedness, and other issues important to medical regulators. While the plan has served us well, we recognize that healthcare has changed dramatically since then, including, of course, the impact of COVID-19. Our goal will be to ensure that our priorities are well aligned with the future needs of the medical regulatory community. Now I would like to thank the Alabama State Board of Medical Examiners, the Medical Licensure Commission of the State of Alabama, and the Medical Association of the State of Alabama for their generous support of today's event. And I would like to invite Dr. Max Rogers, Vice Chair of the Alabama Board of Medical Examiners, to make a few remarks.
Thank you very much. Thank you very much. It is indeed an honor. Again, I'm Max Rogers, Vice Chair of the Alabama Board of Medical Examiners, and on behalf of the Board of Medical Examiners, as well as the Alabama Medical Licensure Commission and the Medical Association of the State of Alabama, it is my pleasure to welcome you to the 2022 FSMB Foundation Luncheon. In Alabama, we have a unique system of these three bodies working collaboratively to further medical excellence and public safety in the state. The Alabama delegation is honored to be sponsoring this luncheon and to help shed light on the topic of today's keynote address: burnout, mental health conditions, and other physical, mental, and emotional challenges faced by physicians and other healthcare providers are always important issues. However, these last 2 years have exacerbated the challenges and have brought to the forefront the critical need for healthcare, treatment options, lifelines, and confidential protection targeted specifically toward healthcare providers. I had the distinct privilege of hearing Corey's presentation just recently in Montgomery, Alabama, at our annual Medical Association meeting, and I can assure you that you are going to find Corey's presentation to be incredibly moving, timely, inspiring, and certainly educational. Again, on behalf of the physicians of Alabama, welcome and enjoy this presentation. Thank you.
Well, it's my great pleasure to introduce today's speaker, Mr. Corey Feist. Mr. Feist is a healthcare executive who co-founded the Dr. Lorna Breen Heroes Foundation, named for Dr. Lorna Breen, a caring and compassionate emergency physician who died by suicide in 2020 during the early stages of the COVID-19 pandemic. Her death raised greater awareness of the heavy burden being placed on the nation's healthcare workforce by the pandemic and the ongoing issues of physician burnout and wellness. Corey, who is the brother-in-law of Dr. Breen, is a strong advocate for mental health support for healthcare professionals. He is leading national efforts to advance well-being initiatives for healthcare professionals, reduce the stigma associated with mental health care, and fund research and programs to reduce burnout and improve provider well-being. Up until January of this year, he served as the CEO of the University of Virginia Physicians Group. It's the medical group of the UVA Health, which is comprised of more than 1,200 practitioners. Please help me welcome Mr. Corey Feist.
Thank you. Thank you so much. Really appreciate it. Hi, everyone. It's great to be with you today. Hold on, I have to take a few selfies with this guy. Hi. Thanks. It's great to be with you today. Dr. Bundy, how are you, sir? How many students were in your medical school graduating class? 400 in your whole class or the whole school? About 100? How many, another doctor here, how many, Dr. Chaudhry, how many were in your medical school graduating class? 130. 400 doctors every year. That's the number. 400, 4 times those numbers. That's how many doctors die by suicide in this country. This has been a moment with you all that I've been waiting to have for a long time, because each one of you holds an important key to helping all of us save potentially 400 lives every year. Think about that for just a second. You have the power in this room to save 400 doctors, nurses. It's unbelievable, the power in this room. I'm literally in awe of you all. And I'm here to help. So let's get started. Let's see, am I supposed to do something here? Uh-oh, I probably have to click on something. Do I just go advance? Is it gonna work? Nope, shoot, we broke it. There you go. Help me. I have to go to that link, I think. Okay. Just talk amongst yourselves. It's all good. We're good. And then we have to hit play on the slideshow. Okay, great. Thank you. Thank you so much. So my wife Jennifer and I founded the Dr. Lorna Breen Heroes Foundation in June of 2020, just a few months after my sister-in-law, Dr. Breen, died. Now, these are one of the few occasions that I have to point something out. My sister-in-law lied to me about several things in her life, but this is the number one thing, which was that running the New York Marathon would be the best day of my life. She ran this sucker in about 2015 and said, "You have to run this race." Well, in 2019, my wife and I got the courage to run it. Lorna was wrong. That was horrible. It is horrible. Don't do it. Public service announcement number 1 for the day, don't run the New York Marathon. So when Jennifer and I founded the Lorna Breen Foundation, it was because of the response. It wasn't because we were trying to memorialize her. It wasn't because we were trying to sensationalize or a suicide. It was because up until this morning, every day since she has died, I have heard from members of your healthcare community, from doctors, from nurses, every single day. She died 2 years ago this week. That's a lot of email, that's a lot of text message, that's a lot of communication, but it's a lot of need. And so I think it's really important for us to pause for a moment, because it's hard for me to tell the story that many times and just see how this has been told over and over again. This piece is from the Today Show from last year, so you'll hear the connection to a year in, but this is, I think, a really important part of the conversation that we're about to have.
We're back as Carson joins us with a tough but very important story that impacts a lot of frontline workers.
Yeah, this pandemic has taken so many lives, but the early loss of a doctor right here in New York City has served as both a warning sign and a rallying point as well.
Yeah, you may remember 1 year ago this week, Dr. Lorna Breen, an emergency room physician, died by suicide. Her sister and brother-in-law opened up to us on the show just days afterwards. And from that moment forward, Jennifer and Corey Feist have been on a mission, laser focused on trying to make a difference in caring for healthcare professionals, tackling the mental health taboos in the medical community. It's been just over a year since the unthinkable happened.
She was my right arm and my left arm. I used to call her my twin, my sister, my other spouse. We were attached at the hip forever, so it's been a real challenge.
A challenge that Jennifer and Corey Feist are meeting by making it their mission to help other healthcare workers, creating the Dr. Lorna Breen Heroes Foundation, and working with their Senator Tim Kaine on legislation that aims to reduce and prevent suicide and burnout among healthcare professionals.
Let's pass this bill and show that we care about our healers and are committed to providing them the resources and the culture they need to keep healing.
It took a lot of courage in those first days of just stunned grief for you to speak out. What has driven you all this time and since those early days?
Savannah, I believe that this could have been avoided. That's what's driven me. And if we can help somebody else in the healthcare profession avoid an outcome like my sister had, this will have all been worth it.
Jennifer's 49-year-old sister Lorna died by suicide last April after first fighting the flood of COVID-19 patients coming into her New York City emergency room.
The volume of death and dying that they experienced was something that they'd never seen in their career.
And then battling the virus herself. The more you learn about Lorna, the more unfathomable this is. What have you come to believe or understand about what led to her passing?
What I know today is the same thing I knew even before my sister died, which was that she got sick with COVID and it affected her brain. The tragedy is she had enough of her faculties to know that if she raised her hand as a physician and said, I can't think, I can't work, I need help, it could have been devastating to her career. We know now exactly the same thing I knew a year ago, which is that it was the combination of COVID and the culture in medicine that killed my sister.
While more than 8 in 10 emergency room physicians like Dr. Breen reported feeling more stress since the pandemic, nearly half polled said they did not feel comfortable seeking mental health treatment, with over 70% saying there's a stigma in the workplace surrounding getting help. It seems like in our culture we talk about mental health all the time and that the stigma has really faded away. But in medicine, that stigma is still there.
Mm-hmm. It's there and it's strong. It is a well-established premise in healthcare that you do not seek mental health care. You just don't. We've heard.
And why? Why?
It's because of the licensing, it's because of the credentialing, and also it's because of your potential harm to your reputation as somebody who can't take it. You know, I will tell you, Savannah, one of the real struggles with my sister was that she thought she was going to lose her license. And what we learned after she died is that New York State has some of the best licensing laws in the United States. And so my question is, why didn't she know that?
Doctors are licensed by the state they practice in, and in some states, the applications ask probing questions about whether they've been treated for mental illness. At times, experts say in violation of the American with Disabilities Act.
Only one state, and that is the state of Mississippi, has the best possible questions. It literally says, we recognize there's a connection there between your taking care of yourself and your quality of care. We want you to attest to us that you're doing that and you're taking care of yourself. We need 49 more of those to happen across the country.
The Feist and their foundation are working to eliminate any barrier to seeking help, just as healthcare workers across the country begin to come to grips with what they've experienced in the past year, a year when they've been more than just doctors and nurses.
We're also asking them to, say the rosary with a dying patient, which is a story I heard from somebody who couldn't be with her father when he was dying. And there was a nurse who said the rosary with him every day. So we're blurring these lines.
Are you worried that we're on the verge of a new crisis, a mental health crisis for healthcare workers?
Oh, there's no doubt in my mind. And there's significant data to back that up. In the heat of trauma, people are just focused on getting through it. It's when things calm down. It's when you relax. It's when you can take a breath. That's when the real problems start. And so, yes, we are so thankful for the vaccines, and we are thrilled. The fact of the matter is these people have been in the battle for a year now, and now is the time that we really need to focus on the people who have been taking care of us for the last year.
I look at you too. I think about meeting you a year ago in the depths of your grief, and I look now at what you have already accomplished. What do you think Lorna would have thought of her baby sister and how hard you've worked on her behalf?
I think she would love it. I think my sister was here for a reason, and maybe this is it. We have made changes, Savannah. We've heard from people who have changed the way they live because they heard what happened to my sister, and I think she would love it.
I love how Jennifer talks about her sister. She says,
So tough stuff, right? I should have started by saying what I usually say, which is if you feel like this is too tough, join me out in the hall, because it's hard. And so there's no problem if you need to take a break. It's not usually the normal lunchtime conversation that you probably have, but I think it's really important. Like I said, and I want to point out that it's not just Mississippi. North Carolina also has an attestation. We're going to get to that in a little bit, but I was incorrect there. We only need 48. We only have 48 more to go, and that's why I'm here. Not just for Jazz Fest, which I learned also is going on at the same time. So in response to Lorna's death, we heard, as I said, an overwhelming number of healthcare workers reaching out, sharing stories. And so we focused our work into the three areas you'll see on the screen: awareness, advancing solutions, and advocacy. So I'm going to give you a little update on what we've been doing. From an awareness perspective, this story has gone viral many times, if you will. It has been published repeatedly in major news outlets. You'll see them on the right side of the screen. And we have authored and co-authored over 11 publications. Our focus has not exclusively been on suicide prevention. Rather, you saw from before the video, we're focusing on the well-being journey and reducing burnout and supporting the well-being of the workforce. But we did also publish an academic article with a number of notable suicidologists and leaders at the AFSP on physician suicide prevention just about this time last year. Also, I have to point this out because my kids make me do this. 7,000 social media followers is too few, according to my son. He said that he's 18. He said no one is going to take us seriously at all if that number doesn't increase, so maybe you can help us grow it by 100 today. We would appreciate it. We have also launched, with the help of the Physicians Foundation, which came out of the North Carolina and First Responders First, which I'll explain what that is in a minute, a whole awareness and suicide prevention set of resources around National Physician Suicide Awareness Day, which is September 17th. That's a day I didn't know existed until Lorna died, and is a day that we're trying to help champion work and programming across the country, as well as embed resources for any health system. And I want to point out, as I started this talk, not only do 400 doctors each year die by suicide, but that's twice the rate of the general public. Nurses are also twice the rate of the general public. So this is an occupational hazard that is shared by our caregiving teams. In terms of numbers, 200 million-ish is about how many people have heard this story. But even more important from that, we have heard from the healthcare workers themselves. This individual at the top of the screen is just one of dozens of examples that I've been able to share. And I think what's so amazing about it, and yet so emblematic of where we are right now, is that she goes on to say that Lorna's death was what pushed her to get help, the details of which I still don't talk about because I fear it will be held against me. Friends, this is how you can help today, and when you get home, this is how you can help. This cannot be held against people. It's unnecessary, and it's frankly a violation of the Americans with Disabilities Act, and my law degree would tell you that. In addition to this, we've heard from the caregiving teams, the mental health caregiving teams of those thousands of healthcare workers who now need it across the country, saying things like, thank you for sharing her concerns around stigma and licensure, because in this one case that's highlighted below, there was a physician who had reached out to say that her reputation and her license were at risk. And so this mental health professional was able to save this patient's life because she recognized similarities in what Lorna had said to us. In terms of solutions, I told you before I would tell you who First Responders First is, because you probably never heard of them. They're not an organization at all, but it's an initiative of the organizations on the right side of the screen. You may have heard of Thrive Global. That's Arianna Huffington's business-to-business mental health company. You may have heard of the Harvard School of Public Health. You certainly have heard of Johnson & Johnson. And you may have heard of the Creative Artists Agency, but I hadn't. It's the world's largest talent agency, and I'm waiting for them to call me, but they must have lost my number. But it's amazing because we have, my friend Amanda Chen is here with me from Participant Media, and we're going to talk about Participant Media's role, but we have been able to bring this conversation outside of the traditional walls of healthcare. In that, what we're doing is we're trying to advance solutions, because what we know is healthcare is super siloed, And healthcare has lots of known places right now that can address this issue. And so we launched All-In Wellbeing First for Healthcare with a whole group of friends. And you can see from this group of friends, they are called our steering committee, that we have tried to span the healthcare space, nurses, doctors, the Schwartz Center for Compassionate Care, among others, to really work across silos in this industry. And our goals are really twofold: to bring solutions, and I want to point out and put an asterisk and an exclamation point here, these are systems-based solutions. To quote one member of Congress who said, "You better not be getting us kitty cat posters and meditation apps, Feist." And I said, "Don't worry, sir. I'm getting you real stuff here. This is not about kitty cat posters." No offense to the cat lovers in the group here. I had 2 cats at one point in my life. I'm still working through those steps, getting rid of that fur and dust in my brain. But in addition to that, we are working to eliminate the persistent mental health and well-being challenges which disadvantage our workforce. Read into that why we're here today. Read into that licensure questions, credentialing questions, barriers that exist that apply to those individuals and not other people. In terms of our progress, we now have over 300 organizations who've joined our initiative. We've launched this website, as well as we've created actually a fund using corporate dollars to help allocate grants. And we've launched this thing called the Wellbeing 5. Now, you may not have heard of that yet, but you're going to hear about something called the 2022 Healthcare Workforce Rescue Package. And it's going to be included in the Surgeon General's report on well-being that's coming out in a month. That's the Wellbeing 5, my friends. So in December, the Surgeon General contacted us and he said, "Feist, I want you and a small group from the AMA, the AHA, a bunch of A's, to get together, and I want the top 5 things that every health system should be doing in this country. The top 5, right now. These are not long-term, these are immediate solutions." And so we've got them on this website, and we also have already started some programming around them. So this is a free resource for you all if you want to take a look at it when you go back home. In addition to that, we have started to get groups together within states. So in Virginia, as an example, that happens to be my home state, we got together the Hospital Association, the Nursing Association, and the Medical Society to create a microcosm of this work, really leveraging their experience with the quality initiatives that they began and you all probably participated in. And then, again, my friend Amanda is here from Participant Media. Participant Media came to us as they were trying to launch the impact campaign for this amazing movie called The First Wave, which many of you may have seen. It's on Hulu right now. Participant Media and National Geographic launched it, and they always have an impact campaign that follows these documentaries. And so they came to us for advice, and what we were able to do was we were able to make this conversation around advancing state licensure and helping you all communicate changes and help educate you all on how to do that as one of our components of the impact campaign. Another component, when you go back home, is that you can have screenings of this movie, and we've got a curated discussion guide. Not curated by me, don't worry. Official mental health professionals have done it, not just this guy. I didn't stay at a Holiday Inn Express last night, folks. So it's not me. It was a Marriott, technically. So The First Wave is a movie that everyone needs to see. Now, in the interest of time, I'm not going to play the trailer for you because it'll blow you out of the room, especially. But this is an amazing first-hand look at what was going on inside hospitals, and in particular, Long Island Jewish Hospital. That's where my sister-in-law trained. So we're not going to run it, but I'm going to show you quickly. These are the Wellbeing 5 that I talked about, or the 2022 Healthcare Workforce Rescue Package. You're going to see this from the Surgeon General soon, and it's intended to be a little catchy. Adjust expectations. These are non-normal times. Get rid of stupid stuff. That's a conversation that every healthcare worker is like, I deal with stupid stuff all the time. I deal with, and if you were a lean practitioner like I am, you would say that's waste. What is it that gets in between a nurse or a doctor every day and their patients? That's what we're talking about. That's the stuff that needs to go. And there's a lot of waste. 70% of a doctor's time on average is spent doing administrative work. 70. Last time I checked, you all didn't go to medical school because you wanted to be administrators like me. You leave that to the lawyers and the documentation experts. No, we've shifted the wrong burden on the wrong workforce. Same with nurses. Nurses spend 50% of their time documenting. Now that we have this workforce crisis, I would ask you, using very simple math, do we actually have a workforce crisis, or do we have enough doctors and nurses, they're just doing the wrong thing? If we got the administrative work off of them, they could take care of patients, and maybe, just maybe, we'd haven't too many. Wouldn't that be an amazing state of affairs? Designating, getting radical to shore up staffing is one of them. Designating a well-being executive, someone who's got operational authority, and then going beyond employee assistance programs. We know the EAP programs are excellent. However, we know that the healthcare workforce, particularly doctors, underutilize those programs. And so there are other programs. Stress First Aid is a great one. Stress First Aid is the program that the Schwartz Center for Compassionate Care offers. It's their peer support program. The number one thing that doctors are asking for across the country, in my travels as well as in the AMA's survey of doctors recently, are peer support programs. And one of the reasons has to do with the reporting requirement that we're going to get to in a minute. Now, for the fun stuff. That wasn't so fun. That was kind of fun. We have a new federal law, the first ever law that is focused on the well-being of the workforce. We did this, friends, in 18 months. It takes roughly between 5 and 20 years to get a new law passed. We did it in 18 months. Now let me tell you what the Lorna Breen Act does. It establishes grants for the training of healthcare professional students. It establishes well-being grants for the current workforce. It establishes a national evidence-based awareness campaign. And it establishes a comprehensive study that we are already starting to use for the Lorna Breen Act 2.0. Because this is the first step of many steps in a whole evolving body of policy supporting the well-being of the healthcare workforce. This program was funded, the law was funded with $140 million of new programs, 103 of which was allocated on January 20th. Before we got the law passed, we got the money out there. HRSA allocated these grants in January, and it was unbelievable. As Jennifer said, it was 103 million points of light spread because of her sister. Anybody ever been to the Oval Office? On March 17th, I was flying back from a meeting, a similar meeting, and I got a call. Mr. Feist, this is the White House. We're wondering if it would be convenient for you to come tomorrow afternoon at 3 o'clock. I said, not really, but I'll be there. A couple comments. President Biden was unbelievable. He's lost 3 members of his immediate family. So he greeted us at the Oval Office with tears in his eyes and his arms outstretched. We had one of the most intimate conversations I've had with anyone on camera in the Oval Office with the President of the United States. He was unbelievable. So just to orient you to who's in the room there, just next on my left is my 14-year-old. Memo to the file, bring one with you if you have access to one if you go to the Oval Office. The President is very fond of his grandchildren and was very fond of my daughter. Senator McCain is to her left. To my right is Jennifer, and to her right is her mother. Rosemary is a retired psych nurse. She was a psych nurse on the same floor that took care of her daughter, Lorna. After he signed the bill, he gave the pen to Rosemary. He said, breaking tradition, which this pen goes to the author of the bill, but Mom, I want you to have it. Couldn't pry it out of her hands for like 48 hours. It was pretty amazing. She was like, this is unbelievable. And then he turned to us and he said, hey, I'm going to Delaware, and he apologized for the helicopter that just landed, and he said, do you all want to come outside? And we said, sure, we'll come outside. We got nothing else to do. I have a reservation at the Cheesecake Factory in 30 minutes. I'm good on time. True story. It's the parking next to it. If you're going to the White House, it's super convenient. So the president took Charlotte by the hand, escorted her onto Marine One, and had her sit in her seat, in his seat. Took my phone and said, smile, Madam President. Pretty cool, huh? She's pretty fond of him now. She might not have been before, but she is now. She thinks she's good buddies. Here's a little fun, if this will run. Let's see. Dad always has to take the camera first. Good job. That was my dad parade wave, if you caught it at the end. My aunt caught it. She sent it to me on a big canvas that is now in my office at home. It kind of looks like this. It wasn't my best moment, but it was amazing. And what I would say is, while that was a really incredible experience, the president he completely recognized that we were doing this for the healthcare workforce. It was an incredible honor to work with members of Congress from this state even. Senator Cassidy was one of our lead champions, but a bipartisan, bicameral members of Congress. We had over 180 members of Congress that signed on to this bill, over 70 associations. We did this completely in a bipartisan, bicameral way, and we got it done, friends, because they recognized the need that we need to address. And the two primary reactions we've received: number one, thank you. You helped us change healthcare. And number two, what are you going to do about licensure and credentialing? You know, I got a chance to testify in front of Congress in the fall of last year, which was a little bit of a humbling experience. Also, another note, do not hydrate before you sit in a chair for 4 hours like you did for the New York Marathon. That was a bad choice. The witnesses don't get to leave the room. Yeah, it was bad. Anyway, that's all good. We'll talk. Is there a urologist? Anyway, sorry, we'll talk. And I said this at the time, and I mean it still today. Given the trauma and burnout that the workforce has experienced, this is like sending the entire healthcare workforce off to war for 18 months and then refusing to support them when they return. And I was talking about what I really want to talk to you about right now, which is how we can work together and amplify your efforts to change licensure questions, to eliminate barriers to mental health that don't apply to other people. If I'd been sent off to war, as an attorney, I wouldn't have these barriers. As a soldier, I wouldn't have these barriers. Doctors have barriers that need to be eliminated. And it's interesting because you may have seen this data. On January 21st, the day after the Lorna Breen Act grants were allocated, Medscape published a report of 13,000 doctors. When asked, why have you not sought help for burnout or depression? The answer behind, I can handle it, is don't want to risk disclosure to a medical board, concerned about it being on my insurance record. And then look at the quotes. I'm afraid that if I spoke to a therapist, I'd have to report receiving psychiatric treatment to credentialing or licensing boards. This is real, folks, and this is, again, an opportunity for us to work together to make a positive impact and literally save lives. So last fall, we published our second time in U.S. News & World Report. The first time was in July of 2020, and we called on U.S. News & World Report on the Best Hospitals in America Day on that time to include the well-being of the healthcare workforce as one of the metrics of what it makes to be a best hospital. And the second time, we reached out to them and I had said, you're never going to believe this, but over the first year of our work, we identified at that time 6 known barriers to mental health access by doctors and nurses. And here they are. And the first 4 are bolded because they all find themselves in questions that may or may not even be known to you, that exist. They also apply in some states. When doctors are sued for malpractice, their own medical records, their own mental health medical records can be subpoenaed by plaintiffs. In what world is that fair, friends? In what world is that right? Well, I'm telling you right now, it's not right, and this needs to change. In addition to that, we know that there are many hospital systems that require their own employees, and many of those are doctors now, to use exclusively their own services. Now, from a business perspective, as someone with an MBA, I would be the first to say, yeah, why would you pay another hospital to take care of people that work for you if you have those services? But talk to Scott Jolly's wife. Scott died by suicide after he left his hospital for getting the first ever mental health treatment of his life because he was traumatized about taking care of COVID patients. Scott's wife would say that if he had had another choice to get mental health treatment outside of his home institution, his entire dynamic would have changed and he'd still be here today. So one of the things that we're really trying to focus on, because you heard Jennifer say that in New York State, the licensure questions are fine. They actually don't even have questions. Anybody here from New York? I see like, all right, can I get a woo woo? All right, New York in the house, sorry. It's like a thing. You all wouldn't understand, the New Yorkers understand. No. I'm a Red Sox fan, in fairness, just anyway. What we're saying is do something that is pretty antithetical to at least my experience in healthcare, which is tell people what the rules are. Tell people. And so we're encouraging every hospital in this country to simply publish to their workforce what the rules are. Publish what the rules are relative to credentialing. Get to this, look at this list. Are hospitals green? Are they red? Are they yellow? What are they? We don't use red because, that would be too negative. Just to remind you all where the Joint Commission is on this. Just about less than a month after Lorna died, on May 12th, they issued this statement. If you haven't seen it, the link's below. It says they do not require organizations to ask about a clinician's history of mental illness. And they point to this organization, the FSMB, as establishing the best practices, which are to limit inquiries to conditions that currently impair a clinician's ability to practice. Current impairment. If you remember nothing from this talk, if you walk out of here and you just think current impairment, current impairment, current impairment, that is it, my friends. Current impairment. That's what you should be asking, if anything at all. So here's the breakdown that a group of us worked on, a private group worked on. And we made a lot of requests, some of them through the Freedom of Information Act. But look where your state lines up here. In the yellow column, there are 31 states that at least we have seen through application and reapplication questions have questions that go beyond either current impairment. Now, I hope this data is incorrect, but I'm not sure it's super incorrect, and I will make a big comment here. This is getting better. There is hope because you all are changing, you're helping to make changes each and every day. We couldn't get the information out of the group in the middle. We're waiting on that. And then 14 states have actually gone ahead and made changes. A lot of the leaders in this movement, including the FSMB, including the American Medical Women's Association, including the Joint Commission and the AMA. And so here's your toolkit, my friends. Here it is. Here's your homework assignment and your toolkit. Please go back and audit your questions. Please go back and change your questions. And if you do nothing else, please tell people what you did and why you did it. All of your applications. There are specialty boards that are on this table. Thank you for your sponsorship, and now I'm going to talk to you. Change your questions, please. Look at your questions. My old boss is an orthopedic surgeon. He would tell you that the orthopedic questions are not so good. He's an orthopedic surgeon, and he would say that. Anyway, I don't want to. Literally, to get into his program, you have to play the game Operation. Remember that game? I was like, really? This is a fellowship question? He's like, you'd be surprised. I'm like, oh boy. Audit all of your questions. Just take a look at them. Change them if they are invasive. Communicate them. And let doctors know that it is safe to get care. We know that there's a relationship here now, we've seen over the last 2 years, of doctors not getting care. Because I spoke with an addiction specialist in New York City just the other day, and she said her client roster of physicians on addiction right now has got the longest wait she's ever had in her career. Because the addiction that's happening, because doctors are not getting healthy treatment, because they are in fear of the professional repercussions, are significant. Now, before I turn it over to you all for questions, I want to point to this. Jennifer says this all the time. And if there is one thing that our work has taught me, anything at all, it's that 1 or 2 individuals can make a huge difference. We stepped into this arena, and we're here to stay. I want to invite you all to join me. Because imagine the power of 150 of you, plus me, in this arena. We can make an incredible impact together and pave the way for future generations. Literally life-saving. There's Jennifer, there's me, there's our social media for my kids so that you all can help us amplify that. Please reach out if I can be of any assistance at all. Thanks to our friends in Alabama for sponsoring lunch and having me down there recently. And thank you to the FSMB Foundation for having me as well.
We'll do a few questions.
Yeah, absolutely. Thank you. Unbelievable.
Well, thank you, Mr. Feist, for that inspiring presentation. We do have a few minutes for questions, so if you have a question, if you can make your way to the microphone, and please state your name and affiliation if you speak. While we're waiting for the first person, person at the microphones, can you tell us what would be your first step that we would do when we go back?
Yeah, thank you so much. And I should have
get the process started.
Absolutely, and thank you so much. So I should have said, so Amanda is here from Participant Media, she flew from California to do that. So she's eating breakfast while we're having lunch, I think, according to the time zone. But we would love to be able to offer you these toolkits. And the FSMB said if it's okay with you all, we'd like to be able to email you directly using those who've registered to be able to just give you toolkits. We know that you're, from a communications perspective, maybe you don't have a communications team to help you spread the word once you make these changes. So we have, the very first thing you can do is pull out all of your questions and literally audit them. And we will send you a toolkit because we've been working with attorneys and all sorts of other folks to help you figure out and give you a roadmap to say, here are the appropriate questions and here are not. And I will tell you, in the toolkit, you're going to see 3 choices. The first, limit your questions to current impairment. The second, don't ask any questions. And the third, follow North Carolina and Mississippi. She just paid me $20 to say that, by the way. And include an attestation that they're taking care of themselves. So those are the 3 choices that we're recommending. Yes, ma'am.
Dr. Burke Haynes from North Carolina.
All right.
Yes. Thank you, Corey, for a very compelling presentation. I wanted to speak with you, just question the issue of medical students. The earlier the better, prevention, the messaging that comes for clinicians as we're training is to be the wall, to, you know, the culture that goes along with that. I'm sure you all have encountered that. And so there's certainly a tremendous amount of work that the boards need to engage and our affiliates and associations. Going downstream, what have you seen? What can you offer? What work have you been able to accomplish in that space?
On the medical students specifically?
Students, yes, and residents.
So we have partnered with the AAMC, you all have probably heard them before, in trying to get this work as upstream as possible. You know, it even starts before, according to 70 medical students I just was teaching about a month ago, they were all coached in their medical school applications by their advisors to medical school not to say anything about mental health. So this gets even upstream of that. But part of the Lorna Breen Act grants, a big part of those grants goes to medical students and resident programs where we're trying to get this conversation as early as possible. I don't have the results of that because a lot of it's starting, but I will tell you one thing about the current medical students and even the residents. From a generational perspective, they have a different expectation about how this profession is going to treat them. They expect and are very comfortable talking about mental health. It's a little different in a good way. And so I think we need to get as upstream as possible with our medical students and let them know that the culture in medicine embraces them. But the biggest challenge is going to be when they go into that shadow curriculum of residency and they don't see that same thing that they were taught in medical school modeled. We've got to come at this from both directions. So I hope that kind of helps. But working with the AAMC, they're super involved here. And this big report that's about to come out from the National Academy of Medicine and the Surgeon General will include reference to that cohort as well. Thank you. Yeah, thank you so much for the question.
So Dr. Hinger.
Yes, sir.
As you know, in 2018, this group recognized this And Mark Staz and myself and a work group put together those guidelines and the use of the word current impairment. Yeah. Unfortunately, we didn't succeed in pulling it off in time for Lorna. But we are a very dedicated group around in this room. And I think we needed that catalyst of you coming here today. And hopefully all of us go back home. And we also have another organization, the Federation of State Physician Health Programs. Yeah. And I know how engaged they are in their concern. And I think we need the impetus of all of our groups to come together and work on this. But I know that, you know, if we follow what you say, we're going to succeed in making this happen, because there's nobody in this room that isn't committed to do what you want. So thank you for challenging us to make this happen.
Well, and thank you so much for saying that, and thank you for your leadership. The last thing I would say, folks, from a pure business perspective, you don't want to be the outliers now in this. As the changes are coming, you want to be able to have an environment in your state where you can recruit and retain the best and brightest. And so you don't want to lag the curve, because doctors are getting wind of where it is healthy to practice and where their mental health and well-being is definitely supported. So thank you for that, and thank you for the leadership, because if you all had not paved the way, the Joint Commission wouldn't have made their statement. I mean, there's a lot of cascading impact here that you all have created. And again, I'm just so truly honored to be with you all today.
Well, thank you so much for being our speaker today. Please join me.
Thank you all.
Thank you for your attendance today, and we look forward to seeing you next year at this luncheon.